Hello, welcome to this masterclass. I'm going to be teaching you how to trick your brain into having pain-free sex. So if you have vaginismus, vulvodynia, or even just a tight pelvic floor, this is the masterclass for you. My name is Dr. Janelle. I'm a pelvic floor physical therapist and the founder of Vagina Rehab Doctor. So the number one thing that you need to understand about your brain and pain is that your brain is actually listening to you and it's shaping your experiences and your behaviors based on your beliefs and based on your past. So, what that means is how you talk to yourself and the things that you tell yourself can actually sustain your pain or even make it worse. So, number one, you actually want to start telling yourself healing thoughts. You want to start saying things like, I can get through this, or my body is whole and my body is healing. If you're saying different things like my body is broken or I'm untreatable or I just can't put this dilator in, your brain will actually believe you. And so it's actually going to be a little bit more resistant to tension, to pain, to even things like dilators that are actually therapeutic if you believe and are frequently telling yourself what you can't do. Okay. So a good example of this is trying to put in a dilator and you're telling yourself that my dilator is getting stuck, okay? And you may actually feel like that's the truth. But another way to reword that is saying, this dilator is stretching me. What that does is it actually trains your brain to reframe the therapeutic behaviors that will actually help you to overcome your pain, overcome your tension, and help you get to buttery, buttery sex. So make sure that you're trying to catch yourself when you're saying things that are limiting, that are negative, and that are really just based in fear. If you're struggling with a lot of avoidance, like maybe you aren't trying to put in a finger because you're scared that you're going to injure your vagina. Instead of saying, I'm scared I'm going to injure my vagina, what you could say is, I'm open to discovering my vagina. So you're open to new feelings, you're open to different sensations. Even if what you feel is tension or something that feels weird or disgusting, at least you're telling yourself that you're open, you're discovering, you're learning. That is going to make all of the difference. And for some of you, simply by affirming your body, talking more positively, focusing on what you can do, you're going to help yourself make so much more progress if you can start telling your brain the facts. And the fact is that vaginismus is curable 100%. Painful sex is curable 100%. These are things that you can actually get through. So that's number one. Okay. So number one, talk positively, speak to yourself therapeutically if you're looking for healing. If your thoughts are broke, if your thoughts are cheap, if your thoughts are negative, that's going to be the experiences that you continue to have. Okay. Number two, and this is a big one, is you want to stop focusing on pain when you are doing something therapeutic. Okay. For example, this is a therapeutic tool. It's called a pelvic wand. This is another therapeutic tool. It's called a dilator. This is another therapeutic tool. It's called a finger. And we all have fingers and maybe you have dilators at home. But if you've noticed that when you try and put in your dilator, maybe you're on a bigger one like this. If you try and put in your dilator and you're noticing that there's a lot of pain when you're putting your dilator in, but you're not going excessively fast. You're not even progressing super quickly through your dilator set either. If you've been using this therapeutic tool for, let's say, weeks or even months, and you're noticing that it hurts when you put it in, what's likely going on is that your muscles are giving you a sensation of pain as a result of your muscles stretching. What's happening is you're having pelvic floor muscles that have been super tight for years. And so pain is not always a bad thing. Sometimes pain is the result of dysfunction leaving your body when you are using a therapeutic tool. So, to be clear, I'm not saying when you go and have sex to just keep pushing through the painful sex because that's not a therapeutic tool. Sex is supposed to bond you together, it's supposed to be pleasurable, it's supposed to be fun, but it doesn't heal pain. And so just pushing through painful sex over and over is likely not going to fix your pain. But when you know that you're doing something that is supposed to be therapeutic for you, exercises, pelvic wanding, dilators, and you're feeling some pain, instead of focusing on the discomfort, focus on what you can control. And I'm talking about if you're experiencing mild to moderate pain. So if you have significant pain, like 8 out of 10 pain, is burning, is stinging, don't try and push through that. But if you know that you really aren't doing anything brand new, it's probably your nervous system that is having a hyperreactive response to something that should feel like pressure or something that should feel like a stretch. Okay. So if you're having 3 out of 10 pain or even 5 out of 10 pain and you're putting in that dilator, try not to scream or freak out or worry or clench or start tightening your abs or closing your eyes. Try and stay present. Try and focus on breathing. Sometimes even just pausing to be a little bit more mindful and present with your body can actually help to bring that pain down because your brain stops thinking that pain is an indication of danger. Okay. So remember that pain is not always bad. Sometimes pain is the result of dysfunction leaving your body. And if you can start breathing through that, if you can start pausing, if you can start telling yourself that you're safe and that your pelvic floor is being stretched, that you're transforming your pelvic floor, these are things that's going to help your brain get out of that fight or flight, get out of that defensive mode, and actually start lowering your pain threshold. And what that's going to do is that's going to make it easier for you to insert your dilator when your pain is down. It's also going to make it easier for you to have sex when your body, with time, week by week, learns that insertion does not equal pain. It does not equal danger. It equals normalcy. And it's a good thing that can happen and you can get past this. Okay. So, number two is when you're using therapeutic tools, don't freak out about the pain when it's mild or moderate. Try and manage that pain. Try and sit there and focus on the things you can control, like your breath, your breath rate, maybe even stretches, different things that are fully in your control. Okay. The last thing that you got to do, especially if your end result is like pain-free sex, is actually focus more on pleasure. Okay. So let me explain more of this. So our pelvic floor muscles are actually attached to the clitoris. Okay. So our pelvic floor muscles, especially the one that surrounds the vagina, that's the muscle that's frequently super tight with vaginismus and painful sex, that entry muscle. Okay. So that muscle actually attaches onto your clitoris. And so when we experience more pleasure, more arousal, even just doing things that feel easy, it's going to be supporting this muscle group to relax and let go. So, one of the things that we like to do with our one on one clients is encourage them to start incorporating pleasure into their pelvic floor practice. Okay. Because let's remember that we're not trying to heal vaginismus just for the sake of it, or we're not trying to heal painful sex for the sake of it. We want to feel better in our bodies. We want to experience more pleasure with our partners. We want to enjoy intimacy and like actually get excited about it, initiate sex. All of that is pleasure. And so when you are focused on the clinical for so long, getting the dilator in, stretching your muscles, going to pelvic floor therapy, sometimes it can be difficult to sort of make that leap from the clinical to the erotic, or from the pelvic floor standpoint to the sexual standpoint. And so when you do your dilation or when you do your exercises or when you go to pelvic floor therapy and you leave that appointment, start thinking about how can I incorporate more pleasure? Maybe that's just you using lingerie more, or maybe that's picking up that sex toy right before you use your dilators or after. But you want to start training your brain to associate insertion with ease and things that feel good, because then you won't just get to the place of pain-free sex. You'll get to the place of actually looking forward to sex because now we're creating a positive feedback loop. Up until this point, your brain has probably associated insertion and sex with pain, frustration, disconnection with your partner, maybe even breakups. I mean, there's probably so many negative associations when your brain thinks about insertion and or sex. And so what we're doing is as we start to move through that dilator set, if you're using dilators. So dilators super common and helpful for vaginismus. For vulvodynia, maybe it's a little bit more nuanced. Maybe you use the pelvic wand, or maybe you're doing myofascial release with a finger. Whatever it is, as you start to notice the pain going down, the tension going down, you want to start focusing on improving your relationship with sex positivity and things that feel good. So don't just focus on whether your vagina can relax enough. Focus on how does this feel in my body? An example of something that I did with a patient a while back was as she was on her second to last session, she did 8 sessions with me. And I believe on visit 7, I had her to go let her husband do the dilation for her. And I told her to eat ice cream while her husband dilated for her. She had already done the dilation set. She was on a bigger dilator. I could tell she was really ready, but I wanted her to start associating her vagina with things that are easy, pleasurable, and fun. And so while it seemed weird, what it did was it taught her to actually think of her vagina as not a scary place, but as a pleasurable place. Pleasure doesn't just mean sex. Pleasure means things that make you feel good and happy. So she sat there on her bed while her husband was inserting the dilator, and her only job was to eat ice cream. And the following week, she had pain-free intercourse in her marriage for the first time in 5 years. And so, yes, the pelvic floor is important in the beginning, relaxing your pelvic floor, doing the stretches, using the dilators, but don't forget to transition away from the clinical and into the pleasure because that's what your brain really wants. And that's what's going to make it easier for you to start associating sex with goodness, with ease, and with buttery pleasure. That's the goal. And that's what I want for you. And that's what you deserve. Now, if you're watching this and you're struggling on your own, you feel like you need some expert help, I want to invite you to schedule a free one-on-one consultation with me. This is a no pressure call, but inside of the call, I'll be listening to you to figure out what are your blockages, what's been holding you back from pain-free sex. And if I think my team and I can actually help you overcome and get to pain-free sex in as little as just 8 to 10 weeks, then I'll invite you to get signed up and to get scheduled so that we can start helping you claim pain-free sex. Thanks so much for watching and click the link below to schedule your free call. Bye-bye.